SCRAM bags. So you guys may have seen that we've done a few sponsored ads on the podcast for the SCRAM bags, and our friends over at the Recess Tailor wanted us to do a review of the bags, or a little tour is what we're going to do today. So I have two bags here, and one is a SCRAM tactical bag, which is the SCRAM emergency bag right here. And then actually, the one I'm really excited about, I mean, the Airway bag is cool, but this thing is like super cool. So the emergency airway drugs, and I'll show you guys that one second. So quick overview of this bag. Now, I thought that this was the go-to replacement bag and that this was, going into an airway bag. And it certainly could, but I think that the tactical bag is built for a little bit different of a purpose because it's essentially two-patient use. You could configure it for more, but it's more of like a large adult, small adult type of a bag. You could put pediatric stuff in here as well, but I think the regular big blue SCRAM bag is more fitted for that purpose. So in this one, we'll open this thing up here, and just to kind of show you the basic geometry of the bag here. So it opens up this way, and then these two things pop up. I'm going to show you guys the insides of these first. We'll start with the inside of one, and then we'll just go over to the other one. So this main side over here. So this is the first area where you have a full patient setup. And so this side cues you in. I'll show you guys that they have, well, you guys can see BVM, Untitled CO2 filter, and you guys see that there's cutouts for everything, or not cutouts, but markings. And so this one will say Mac 4 over here, but this one over here will say Mac 3, so larger, smaller. And everything you essentially need is in here. So there's a area to loop around your bougie. So that's what I put up here in these little straps. So I put the bougie, kind of goes around McGill's forceps, a direct blade. You could put video learned scope in here as well. Suction, and obviously all this stuff would be in packaging. Some of it is, some of the stuff I didn't have in packaging. Decanto catheter, obviously. Endotracheal tubes, you could put a bunch of different sizes in here. Regular stylet, syringe. Up here, now I put this in here, and I wasn't sure about which supraglottic airway to use, and this isn't where you need to put it. This is, I picked the most difficult to pack supraglottic airway, I think, because this one, it has this big handle on it, and then it has this large syringe, and then you've got the tube introducer, because this is one of those ones, it's like an intubating air track or whatever it is, and, or air cue, whatever one it is, you guys will know. But it's bulky because you got a big syringe, then you have this special endotracheal tube that comes with it and stuff. Obviously, this stuff would be packaged differently if it was still in the package, but if it stores that, I figured your backup airway is pretty good. And then Untitled CO2, and it has a lot of these little tabs on here so that it can be somewhat standardized. And even if you can't get your hands directly on the bag, it's really easy to describe to somebody else who's getting stuff for you where stuff is in the bag because there's so many labels that are pretty bright colors. I'll come back to this thing, this pull tab last. That's actually pretty cool. And there is, because of this pull tab, pulls something out, there is a whole like pocket behind here where you could put other stuff. Okay, inside of the other side, very similar, almost identical, not quite. This would be where the Mac 3 is. Now I put some different stuff on this side because, just for this is like my little simulation setup. I thought that it would be cool to have the video laryngoscope in here. So I just put it in with the endotracheal tubes. And then there was actually room, I was surprised. I was able to put a whole rigid stylet in here. It's a little bit tight, and it's not the Glide Right, it's the Copilot VL, but it fit right in there. It's a little bit tight, but it's fine. And then tube holder goes on this side. You can put different types in here, and then there's a bunch of, actually, I guess there's two spots for, I don't know who needs that much loop, but syringe over here. I put a tube clamp in here as well. And so you can see very similar between these two sides. Essentially larger patient, smaller patient, but you could also configure this for DL, VL if you wanted to, really anything. And then the inside of this next one, I didn't put my tube clamp on very well. On the inside of this one is pretty cool. I just put a vent card in here, but if you had an RSI card that you were using, you could do that here. And then this is a little whiteboard, which is pretty cool. There's a little spot. I didn't have a dry erase marker, and I almost made the classic mistake of using a permanent marker on this, which I'm glad I didn't. But you can write down all kinds of stuff in here, and then you can dry erase it, and you can even cover over it with whatever you have, or nothing at all. You could draw stuff here, or write down dosages, or whatever you want. And you could just cover it with this, and then it wouldn't get wiped off if somebody was moving the bag, or you could put an actual card in here, but then you wouldn't be able to see your notes. So kind of a toss-up. There is actually a pull tab right here as well, so there's another pocket back here, and I didn't have another like Airway reference card or anything, but whatever you put in here, you can package something so that when you pull the tab, it comes out of there. I just put like a random reference card in there, but that's kind of cool that it's that easy to get out of there. There are some straps here that go down to these ones, so you can essentially like strap this down if you wanted to. I don't know who would do that. It seems a little irritating to have to undo these to get to the stuff on the other side, but maybe somebody could think of a use for strapping these down. I feel like it's all pretty secure when you just close the bag like normal, so I don't know why you'd want to do that. But okay, coming to the outside of these things now. I'm going to start on this side. So here's a lot of VL blades aren't as bulky as this, and you have to figure out a different way if these are packaged, but I just put a channeled and a non-channeled in here. Simple airways can go here, and then this BVM and filter and stuff, this is actually, I think, supposed to go over here because it says like Untitled CO2 and filter. So maybe that's supposed to go up here somewhere. I don't know. You can really do whatever you want. I guess you don't have to put it where they tell you to put it. But filter and then a PEEP valve as well, I thought was really important to have right in the bag. Other side, like I said, tube clamp, another syringe. I'm gonna show you guys inside this real quick before I talk about this. There's little tabs right here. So this one just says nasal O2, which I think is really cool because it's promoting good preox, promoting apneic oxygenation. If you need high flow, you could use this. You could also put a mask in here or whatever. And then the last thing that I'll show you on this bag is, well, first of all, I didn't realize this at first, so I'll take you guys on the journey that I went. So surgical, everything for your surgical airway is in here. So you just reach in here, and I put everything inside the pouch, but there are side pockets too. And so you pull this out of here, and I have a prep, a scalpel, the tube, and then the bougie. And that's pretty nice. So then I realized, after messing around with it, that I didn't realize before, was that you can just take it off. And then there is your surgical airway kit with everything that you need. And honestly, there's not that much stuff in here. There's a lot of room left in this pouch, so you could do a bunch of different things inside of this surgical airway pouch. So that's the basics of this bag. This is how I chose to set it up. You might choose to set it up totally differently. But it holds quite a bit of equipment. But like I said, I don't think it's, in my opinion, not meant to be a full airway bag, although you probably could do that with it. But if you're going to use it as directed, kind of the simple patient setup, 2 or 3 patients, depending on how you pack it up. Oh yeah, I almost forgot this. So this pull thing right here, where I showed you guys that it has the extra pouch back here. So if you pull this out, and it is actually a little bit difficult to pull out. It's definitely not going to come out by accident. So you can pull this out. There's Velcro back there. And this gives you a field to set all your stuff up. So if you wanted to, you could actually pull this out of here. Comes off pretty easy with the Velcro. And then, like, if I wanted to, I suppose I could just put this out. And this is where, if I was setting equipment up for somebody, obviously this one says, skin prep. This is for scalpel and stuff. And over here, kind of the same thing, except you have the actual tracheostomy tube right here. And so set up for very specific things, but you could set everything out for that difficult or whatever airway. Also would just give you a field to set up a regular tube as well if you weren't using the inside of the bag. And so I'll put that back in there in a little bit. But second bag, emergency airway drugs. The first thing you note is that it says calculated drug dosages, so drug and dose. And you can actually, again, a little thing for a dry erase marker, but I didn't have one. This is actually a pocket, and so you could put drug dosages. You could print something off that says, whatever drugs you carry and their dose, and then you could just write over that. So imagine you print a white piece of paper with some black text on it, you do your drugs, your dosages and stuff like that, slip it behind here, and then you can draw over it with the dry erase marker that's in here, and you could note the time, or you could get pretty creative with that actually, since you can mark over it. Okay, cool. So the other stuff, your opioid, your induction agent, your muscle relaxant, and then your flush right here. And these are just little elastic ties. They're almost like little elastic shoestrings where the hard end of the shoestring, what's that thing called, is together. And you can tighten these up on their other side. So, or you can just use this little pull tab right here. And that'll secure the vials in there. So this thing opens up even more. And then you have benzodiazepine. This is just a white area. This one is unlabeled. This one is the vasopressor. So whatever you're going to put over here, maybe you do an epi and you throw in a flush, or whatever else you would need to maybe make push dose pressors. And then over here you can put in whatever you want. So these two are staggered, and then these are standardized across the top. So there's a room for a lot of different vials in here. And then I'm assuming this one over here is probably for different types of syringes is what I would use this for. And then I put needles up in this top one. You would also probably put the alcohol preps either in here on the outside or put them in with the actual needles. And then you could store some extra stuff on the back side here. This is what I was talking about, where the back end of some of these are adjustable. And you can just do two. So you could do medications on the back side here as well. Small pouch, and then it has a larger clip back here for whatever you need to store. So this is very simple, this emergency airway drugs bag, and it's pretty small. Like, I'll put where's my phone? So here's my phone, an iPhone 12. It's like the big one, the Pro or whatever, the Max. And so that's how big this airway bag is, but that is going to have a lot of storage capacity for those drugs and very specifically labeled. So those are the two bags that I wanted to show you guys. The emergency airway SCRAM tactical, and then the one that goes along with it, which is this emergency airway bag. So visit our friends over at Recess Tailor and check out these bags. We'll leave a link in the description in case you guys want to get a hold of them. Take care, and we'll see you next time.